Welcome back. In this video, we'll focus on problem-solving therapy, PST, exercises, and how to apply PST techniques to simulated real-life cases. Problem-solving therapy is a structured approach to helping patients with depression identify and overcome obstacles that are contributing to their emotional distress. It's based on the idea that ineffective coping and poor problem-solving skills often exacerbate depression. By teaching patients how to approach problems in a structured way, we can help them improve mood, reduce stress, and ultimately manage their depression more effectively. In this exercise, we will walk through a couple of simulated cases where you'll apply the steps of PST, identifying the problem, brainstorming possible solutions, evaluating the solutions, and implementing an action plan. By the end of the video, you'll have a deeper understanding of how to apply problem-solving therapy in real-life situations. Let's start with the first case. Case 1. Sarah's work stress and depression. Imagine you're working with Sarah, a 30-year-old woman who is experiencing moderate depression. She reports feeling hopeless, unmotivated, and constantly stressed due to her job. Sarah works as an administrator in a busy office, and she feels overwhelmed by her increasing workload and tight deadlines. She feels trapped, and that her job is the main source of her depression. Step 1. Identify the problem. Start by helping Sarah identify the core issue that is contributing to her distress. In PST, this is the first critical step, understanding what the patient is facing. Ask Sarah, what exactly is happening at work that is causing you stress? How does it feel to face these challenges day to day? What part of your job feels the most overwhelming? For Sarah, the core issue is the increasing workload, which she feels unable to manage. She feels like there are too many tasks with little time, and it's leading to constant anxiety and depression. Step 2. Brainstorm possible solutions. Next, help Sarah brainstorm possible solutions to address the problem. In PST, this involves thinking about all potential ways to tackle the issue, no matter how big or small. Encourage Sarah to think creatively and consider different approaches. Some solutions might include delegating tasks. Sarah could delegate some of her work to other team members, especially if they have the capacity to help. Time management. Sarah could explore time management techniques, such as prioritizing tasks or using a task list to break down her workload into smaller manageable chunks. Talk to her manager. Sarah might consider having an open conversation with her manager to discuss the workload and see if there are ways to redistribute tasks or extend deadlines. Step 3. Evaluate the solutions. Once Sarah has a list of potential solutions, the next step is to evaluate each option to see which one is most feasible and likely to help reduce her stress and improve her mood. Ask Sarah, which of these solutions feels the most manageable for you? What do you think might be the impact of delegating tasks or speaking with your manager? In Sarah's case, delegating tasks and time management are realistic solutions that she can try immediately. Talking to her manager might feel more difficult, but it could be a longer-term solution that leads to a more manageable workload. Step 4. Create an action plan. The final step in PST is to create an action plan. Help Sarah outline concrete steps she can take to implement the solution. For example, Action 1. Sarah can start with a daily to-do list and prioritize the most urgent tasks, setting aside time each day to tackle one thing at a time. Action 2. Sarah will ask a colleague to help with 2 specific tasks that she feels are taking up too much of her time. Action 3. Sarah will schedule a meeting with her manager to discuss her workload and see if there's any flexibility with deadlines. By taking these steps, Sarah will feel more in control of her workload and begin to reduce the anxiety that has been fueling her depression. Reflection questions. How did identifying the core problem help Sarah understand her stress more clearly? What made delegating tasks and time management viable solutions for Sarah's situation? Let's move on to the second case. Case 2. John's relationship problems and depression. Now, let's look at John, a 45-year-old man who is experiencing severe depression due to relationship problems. John has been married for 15 years, and recently, he and his wife have been experiencing increased conflict and communication issues. John feels isolated, unheard, and that his marriage is failing. This is contributing significantly to his depression. Step 1. Identify the problem. In PST, the first thing is to understand the problem. For John, the issue seems to stem from communication breakdowns in his marriage. Ask John, what specific issues are you facing in your relationship? How do you feel when you try to communicate with your wife? John might say that the core issue is feeling misunderstood and that communication has broken down to the point where they argue frequently. Step 2. Brainstorm. Possible solutions. Help John brainstorm possible solutions to the communication problems in his marriage. Some options might include couples counseling, seeking help from a therapist to address the communication issues and improve the relationship, setting time for open conversations. John and his wife might agree to have regular, calm, scheduled discussions about their concerns. Learning effective communication techniques. John could try learning skills like active listening and assertive communication to improve his interactions. Step 3. Evaluate the solutions. Now, evaluate each solution. For John, couples counseling might be the most effective long-term solution, but he could also start with open conversations at home to improve the immediate tension. Consider, which solution do you think will be the easiest to implement first? How can you start small, like setting aside time for weekly discussions, before committing to counseling? Step 4. Create an action plan. Finally, help John create an action plan. Some steps could be: Action 1. John and his wife will set aside 30 minutes each week to have a calm conversation about their feelings, free from distractions. Action 2. John will research couples counseling options and reach out for an initial consultation. Action 3. John will practice active listening when talking with his wife to improve their communication. Reflection questions. How does effective communication help John address his relationship stress? Why is couples counseling a viable solution to the problems John is facing? In this video, we've seen how problem-solving therapy, PST, can help individuals with depression identify the core issues contributing to their distress, brainstorm potential solutions, and create actionable steps to manage their symptoms. Whether it's dealing with work stress, relationship difficulties, or other challenges, PST empowers patients to take control of their problems and build resilience. In the next video, we'll explore role-playing scenarios where you'll practice applying treatment plans in real-life situations. Let's keep it going, and I'll see you in the next one.